You've worked in clinical practice, teaching, and research in autism. Looking back, what led you to this field?
It's a long story. I've started first to be an adult psychiatrist.
Okay.
And working on schizophrenia.
Okay.
I did a PhD thesis in molecular genetic in schizophrenia because I was really interested in combining research and clinical practice. And for me, it was when I say all those people, without any solution. When I was a young MD, I told me that we have to find solution. We have to do better for them. And then I was married. I am still married with a guy who lived far away from me. We were separated. And there was an opportunity to get a position in the city he lived in. Was on child psychiatry, autism, no more adult psychiatry, no more schizophrenia. But the vision was the same, about this link, the close link between research and clinical practice. And even the question, was the same of the way to address the problem. So I've been to autism field because of this interest, and also by love to join my husband.
It's very nice, a very nice motive. You often focus on the importance of early detection. Which early signs do you find most important today?
The first point is that we have to listen to parents.
Okay.
Because usually, parents, especially when they have had a child before, they recognize the early sign. And this early sign can be about a problem about the gaze connection, also about the joint attention. The child cannot point out, for this to engage, the attention of other. The fact that the language doesn't develop well, but also now we know much more that in the first months of life, some motor coordination problem can be also maybe an early sign of autism. So it's really important to listen to the parent and to see whether it's the trajectory is different than the typical one. And even if it is on gaze, on language, on motor, then we have to say, okay, maybe we have to go further for the evaluation. Not only for looking for autism, looking for neurodevelopmental condition.
Totally. Do you think it's useful to do preventive programs or stimulation programs before the diagnosis?
This is difficult question. The preventive program, I don't know if we can say that now, but for sure what we say is that once we have observed developmental delay or developmental trajectory different, you can start intervention, for example, sensory motor intervention, even if you don't have the categorical diagnosis. This is important. It's not primary prevention, it's secondary. It means that once you have observed something, you can start something. So what we call about innovative technology, from innovative technology, you go from screen to, in our department, for example, we have a chair for compressive pressure. It's also innovative technology. Or we have a device for immersive video training. It's also innovative technology. So I think that this word of innovative technology, it covers a wide large variety of things. Screens, it's really a question. We know that it's a tool that can really help the child to be motivated in, but we know that, of course, it can be also an excess of use. It's very difficult. So, and it's a question about also parents using this, because if parents are looking at all day long, to their phone, they're not looking at anymore to the child. So I think that all those technology, there are opportunities for sure, but we have to keep the control in the use of this, and we have to know what we do with them. And it's in the future we have to test whether it can help, or also, especially for example for autistic children, it will lead to more self-centered interest. It's a big question, but for sure we have to address this question, and I'm really positive with the fact that it can help. Okay, but it depends which kind of innovative technology, in which condition, and always with therapist or control, not the child alone. With that.
Totally. We often treat like neuroscience or genetics or neuroimaging like separate areas. How can they work better together to help people with autism?
They have to be combined. The genetic level, the neurophysiological one. There are different levels of the same diagnosis assessment. For us in our center, the child, when he has a diagnosis assessment, he has also an EEG, he has also genetic counseling, he has also just to address the different question, so it has to be together. I know that depends if you have access to geneticians or not, can be difficult, but it's what I call the 3 levels of diagnosis, the categorical one, the functional one, and the biological or developmental one. And for this one, you have to go from genetic to EEG, MRI. Not every child has MRI in France, for example, because it depends if you need a specific anesthesia or something like that, and it's not in the national guidelines, for example. But I think that in the next future, the child will have all this complete assessment. And our excellence center in France, is built really in this vision of the link between clinical research and clinical practice and research, and it helps both, because having a research team within a clinical department, it can really helps to improve knowledge about the clinical stuff. And also the researchers are really helped by having discussion with the clinicians. And the point is to have research based on a clinical problem, and also research based on the parents' question. And that's why I think that you can't separate clinical and research, and you have to make this strong link together, because it helps both.
But it's not common. It's not a common model. I don't know if you have like any tips for other universities just to approach and work together with the clinical services.
People they try to. In France, we have what we call the university hospital, and so there is this link between also university and hospital. The point is in our excellence center, we go further because we are in the same building.
Totally.
And it was built like this in the late 80s. So it's more than 50 years ago that we have the research team is within the clinical department. We have also the teaching, the university department for teaching and training in the same building. So it's a link not only between clinical and research, but also for university training. So yes, this is it's an exception even in France, to be so gathered all together. It has been built in the late 80s by Professor Lelore, who was really a pioneer in this vision.
And what has changed through these 50 years?
And what has changed is that we became bigger and bigger. We have developed different units for very early diagnosis. We have developed an adult also unit. Okay. So now we are more than 200 people working in this center. At the beginning, it was only 20 people. So it's the same philosophy, but with different expertise now. Yes, we have a research project on this question because we have also make the link with people specialized in other life, even psychiatrists also, and but researcher, cognitive neuroscience researcher. And we have run the project, these people combining MRI, clinical data, neuropsychological evaluation, and it's an ongoing process. But you're totally right. It's a big question for the future. It's not so easy. You're right, because they are usually separate fields, you know. But I think that when they learn the basis of neurodevelopmental condition functioning, it's really important to give them the big picture of the life. Even if then they will be specialized in early intervention for young children, the fundamental basis is the developmental trajectory. And if people understand that once they see a child, even 5 years old, he has already 5 years old of developmental point, and he will be an adult. You change your vision of neurodevelopment, and I think it's really relevant to better understand what you going to do for the diagnosis assessment, but also mainly to define the individualized program. And to try to make this mix in our department, we do it because as we have all these units, for example, the student in med school, also the psychologist, when they come to the center for training, they have moment in the early intervention unit, but also to the adult unit. So they experience all this trajectory of the people from early childhood to even adult life, because they can see both during their stay in the center.
There's a lack of training for professionals that are not involved directly with people with autism, like, I don't know, hairdressers, dentists, dietists. Do you have any project or any idea about that?
Yes, it's a very important point, because it's always difficult to for this professional, to know exactly what the child or the adult can feel, can perceive as an autistic person. And we have recently developed an escape game to help people to really perceive what can be my autistic world, and so they will have to discover things. It's a scenario, specific scenario in an escape game, but to solve the problem, you have to also think like an autistic person. So I think it can be in combination with academic or fundamental training, can be a good point for them to really experience what an autistic child or adult can perceive.
Totally.
And I think it will help them to adapt better their intervention.
Totally. It's very useful for families and also, parents too.
Exactly. Yes. Also, it's because it's so difficult for people to understand what is their world, or how they interact, how they can perceive people also. So I think that all these new, it's not technology or about device, which can help a professional to really understand that can be really useful, not only for intervention but also for training.
Thank you very much, Frédérique, for this interview.
Thank you very much.
It was super interesting.
Yes, thank you. Yeah, thank you very much.